Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to the Tech Blog Writer Podcast. I know you're all fed up of receiving gazillions of Black Friday and Cyber Monday emails, all saying buy more stuff. And I know this because I'm fed up of them too. I think most of us were exhausted and suffering Black Friday fatigue before it even began. So instead of buying more stuff that you want but don't necessarily need, I want you to learn more stuff rather than buy more stuff. So today I want to learn more about how a company called GYANT addresses and treats the most prevalent yet manageable illnesses that comprise the vast majority of our primary care visits. For example, I'm talking about flu, earache and similar ailments that we all experience. Ultimately, GYANT is helping save money, time and worry, and making the healthcare experience more convenient and streamlined for both patients and practitioners. And as you know, technology's potential to transform healthcare is huge. And while there has been a lot of progress, it's still not there for people. It takes weeks to schedule a doctor's appointment, so usually people stick it out until those symptoms go away, only to end up needing urgent care further on down the line. And free online symptom checkers like WebMD aren't well suited for medical content either. People end up scanning for answers to their symptoms and coming away more scared than ever, and I think we've all done that at some point. So telemedicine has a lot of positives, but it's not always convenient for patients. Example, finding the time, place, willpower, etc. to get on a video call, or indeed the easiest kind of business to scale. So the team at GYANT set out to bring together the best of artificial intelligence and real medical practitioners to accurately diagnose common illnesses and share treatment plans, all in minutes from a mobile app. But enough spoilers from me. Buckle up and hold on tight so I can beam your ears all the way to California so we can speak with GYANT CEO Pascal Zutter, who's going to share his story that spans e-commerce, gaming, healthcare, and how GYANT is actually transforming healthcare. So a massive warm welcome to the show, Pascal. Can you tell the listeners a little about who you are and what you do?
Sure. So I'm Pascal. I'm a co-founder of GYANT. And what we are building is we're building a new care service. And we do that by integrating artificial intelligence on one side and experienced doctors on the other. And we bring them together so that we have a highly accessible, surprisingly delightful way of informing you, giving you your diagnosis, and giving you treatment as a patient. And we emphasize empathy in the process. And so what I always say is we don't want to build a tool that is just diagnostic. What we want to build is, imagine you had a friend who happened to be a doctor that you can text with anytime. That's what we're doing. And I've had the idea for GYANT actually for a long time. Happy to tell you more about that.
Now, at GYANT, you are on a mission to make primary care better, easier, and more affordable experience for everyone. And to make this a reality, we need patients, providers, and innovators to come together to reshape the whole healthcare industry. So can you tell me more about GYANT and the mission that you're on there?
Absolutely. So our mission is at the core to help providers do more. And where we fit in is that we're building a new healthcare service that exists to close that gap between Googling or WebMDing your symptoms and that time-consuming, very old process where you call your doctor between 9 and 12 a.m. and then you have to wait for weeks until you get your appointment. You travel to that clinic, you wait on that crinkly paper bed thing for who knows how long until somebody finally comes into the room to actually help you. And that's what we want to shorten. And so what GYANT is it's like texting with your doctor at any time. So we combine artificial intelligence on the one side and physicians on the other, and we help you get to your diagnosis and prescribe treatment. And we focus on the most common non-urgent illnesses. We've learned that if you look at telemedicine, for example, and that reflects very well what's happening out there. If you look at telemedicine, 95% of all interactions there result in 23 different diagnoses. So while medicine is such a complicated field, there is a long tail, but most of us are sick with the same things over and over and over again. And these things, they they clog the pipes in the healthcare system, and that's where we come in, and we want to help people have fast resolution for their problems. And while doing that, we want to be empathetic. We integrate with health records as well to know your history. And one very important part of what we do, and that's again similar to your friend who happens to be a doctor, we only start with the first conversation, but then the next day we'll check back in with you through our AI and make sure that you know what's expecting you, how long your condition is going to take. We ask you for new symptoms that may have come up to identify red flags, and if there are any, escalate you back into a doctor's hands so that the doctor can take care of you.
And something that's probably more important over here in the UK than sunny California is that we're about to enter the dreaded flu season. So how does something like GYANT tackle prevalent yet manageable illnesses that actually comprise the vast majority of primary care visits on both sides of the Atlantic?
Yeah, you would be surprised. Many people do have the flu here as well. The weather gets a little bit wetter during the winter days, and so we do have a flu season here as well. Obviously, it's not as such a pronounced phenomenon as it is in the UK or in other colder countries. Yeah. But so the experience that you have when you have a flu is that for sure you'll be sitting in that waiting room forever. And at that time of the year, everybody has that, right? Everybody's sitting there, and the fundamental problem, and let me give you just like some data around that. The fundamental problem here is that 46% of the people under 30 don't have a primary care physician. That's a high number. Yeah. And that has completely changed. If you look 20 years ago, 95% had a primary care physician, and now that's not the case anymore. And then, because you are referring to the flu, a third of flu cases of young adults, are diagnosed in the emergency room. Imagine that. Mm-hmm. And so that all of that, not only the flu, but more of these low acuity common conditions, they drive up healthcare costs significantly. So unnecessary emergency room utilization in the US is a $64 billion problem. And it's not only the financial side that is a problem, but also it's a problem for the doctors, because physician burnout has become a major topic. And we're working with health systems and with hospitals and with health insurances as well. And so oftentimes they obviously employ physicians, and these physicians, they suffer from burnout, from just being overloaded. In the US, in 10 years, we'll be 50,000 doctors short, 50,000 primary care physicians. And this is a problem you can't solve in a couple of years, because the education of these people, of these doctors, takes 15, 20 years. And physician burnout is the highest among emergency room doctors and family doctors. And then, as I said, we work with health systems, and they tell us that their emergency room usage has doubled in the last 10 years. But at the same time, we see that 50% of the visits to the emergency room, 50% are things that could be treated at home, where you wouldn't have to see any doctor at all. As I said, that's where we're tackling the problem. We're coming in and we try to be very, very good on these low acuity common conditions that happen all the time. We try to do that under 10 minutes. We always say it's 7 minutes from picking up the phone to having the prescription in your pharmacy. And we do that by using as much AI as we can to support physicians to have access to the right information about the patient, so that they can diagnose and treat patients much more efficiently than they do right now. And by that, they're able to help more patients. They can decrease the people in their waiting room, right? We can get people out of that waiting room. We can treat them remotely through our app, so that they don't actually have to show up there. So we help the doctors focus on what they do best.
So in the long term, I'd love technology to be able to help build a more proactive healthcare system where we prevent problems before we get that lump, that rash or sickness. And while there has been a lot of progress, it's still not there for a lot of people. I mean, it can take weeks to schedule a doctor's appointment. So usually people just stick it out until the symptoms go away, or actually end up needing more urgent care. So how do we get around problems like this?
Yeah, obviously that's a big question that keeps us all busy, right? And keeps us thinking. And a lot of the digital health is around that promise. But still, if you and you're right, if you look at the world and you wake up in the morning, you feel sick, what are your options? Yeah. Right? One is obviously to go and search, but search algorithms are just not very well suited for medical conditions, and they don't account for additional layers of questions around demography, around pre-existing conditions, around chronic conditions that you've been mentioning. So all of that does not really fall into a search engine's result. So what turns out is that search engines over-prioritize hyped conditions, and they play on our fear a little bit by that. We click on these things. We're much more likely to click on that tumor than clicking on the flu. Yeah. And by that, it turns our curiosity into anxiety, which is a sad thing, actually, right? And so that's the online option. On the other side, you can go to the point of care, but that experience is totally broken. As I said before, wait times are long. The experience isn't great. You sit in the waiting room with all these people that are probably sicker than you are. And so what we try to do is we try to start a conversation in that moment that you are really sick, and it has been like that forever. People don't come to the doctor to treat, to prevent illnesses. They come to the doctor when they are really sick. And so in that moment, we say, hey, we're here for you. We're going to help you with this. And once we have diagnosed them, probably prescribed treatment for them, then we'll continue to check in. And I always say that GYANT's power it's a little bit like an iceberg. The first conversation that you see when you first try it out is just the tip of the iceberg. And then there's, 85% of the product is actually in the follow-ups. And these follow-ups, they do many different things with you. So they can be just checking in and finding out about your symptoms and how they develop. But we also have stuff in there that educates you about fun stuff and things that are just unusual, where we send out like educational content, and I always talk about that because it's kind of funny. Our best educational content that most people really want to interact with is something that we call the poop scale. So it talks about color of your poop, and there's a lot of education to do around that topic. And actually, if you're a parent of young children, probably you'll remember that at some point while your children were little, you called your doctor and he said, that's a weird color. What do you think about that, doctor? And pediatricians, they tell us that if we can just get people not to ask that question anymore, because it's easy to answer, that would save them years of their lives, because it happens so frequently. So there is much more content that we've built that helps us educate our patient, make sure that they know better about their health, and that we can prevent them from getting sick the next time.
I'm glad you mentioned the whole anxiety caused by just Googling things. And it takes me back to my granddad, who always used to say, I refuse to have any medical books in the house. But now we all have access to free online symptom checkers. I mean, do you think they do more harm than good? I mean, they actually just create, a society of the worried well that are always convinced that they've got something?
Yeah, the society of the worried well. That's a great term for that. I think looking at symptom checkers and those of the past, I think that in the end, usefulness wins.
Yeah.
Right? So people who are sick and who have a complaint and want to know something, are concerned, they're looking for something that can help them there. So usefulness is for us priority number one. And what we try to do is if you would have that friend who happens to be a doctor, he would not read out the Wikipedia page about the flu to you. He would look into it and say, okay, here's this particular piece of information that's exactly for you. That's the one that you should read, and that's relevant for you. So he creates that relevancy. You don't get cookie cutter information from your friend. It's super personalized. And that's one part that we do. Give you highly personalized information exactly about what you have, and make sure that it's also written in a way that you would understand it. The other thing that makes GYANT so useful is we don't only give you information. We don't tell you, you got the flu, or you got a urinary tract infection. Now, we go a step beyond. We say, okay, so you have a urinary tract infection. Here's your prescription. I'll check in with you tomorrow. And then if, for example, tomorrow you still have pain, we'll tell you, that's fine. Antibiotics need 24 to 48 hours. Don't worry, right? And then we'll check in with you. We'll ask whether you developed a fever. And if you did, we'll keep you safe. We'll make sure that we'll say, okay, with these symptoms now, I think that you do have to go into a primary care physician or to an OBGYN and get tested. So that's one thing that we do. And to go a little bit deeper on this, symptom checkers are, as I said, a little bit of an older technology, which is totally fine. But what we do at GYANT is that we account for different layers of that matrix between symptoms and conditions. For example, we know that right now the flu season is starting in London, but if you're in Los Angeles, it's not, right? So diagnosing patients in different geographies has a geographical dimension. Or, for example, if we see symptoms for a UTI, a urinary tract infection, in a 24-year-old woman, it's fine. We know exactly what to do. The protocol to diagnosis is very clear, and it's not a dangerous condition. But this changes significantly if you're not a 24-year-old woman, but if you're an 84-year-old woman. Now the same condition has very, very different implications. So that's something that we want to account for to make sure that we're highly useful. But I have to say that your granddad was a very smart man. Everybody knows Googling symptoms is bad, but have you ever tried image search? So that is even the worst. That's even worse than that. So if you try Google image search with your symptoms, you'll get results that are massively scary. And we've recognized that from the beginning on. And we said, okay, we're in the business of helping patients self-report symptoms. And obviously, it's nicer if we could just give them a photo, a picture. And then they could look at themselves and say, okay, is that what I have? Does that look like that? But all the imagery that we found was medical imagery that your granddad didn't want to have in his bookshelf, right? And so I have a background. I've led and built one of the largest European video game publishing companies. And so we reached out to our network there, and we had a creative director of a very big mobile game build and draw and make condition images for us. So we have over 800 of those that explain your condition really well in a playful manner. You know what we're actually talking about, and it's not threatening. And we've also built content around the text so that seventh graders would understand that. So we've put a lot of energy into this, making this an empathetic experience that's not scary, that at the same time explains you really what you have, so that your granddad, would be happy with it. Yeah, we even have something that we've just started where we want to include a little bit of sound design. So imagine you would be talking to R2-D2 about your condition, and he would come back with his little sounds that would make you feel that he really understood what you have. So we're working on a little project like that. So that's how we're thinking about this. Your interaction with your health could be surprisingly delightful. Nobody has really done that, and that's what we're in for.
And as we're talking about artificial intelligence and healthcare in the same sentence, I think it's important to highlight that you're not replacing doctors, but combining the best of AI and real medical practitioners to accurately diagnose common illnesses and share that treatment plan in minutes on a mobile app. So can you tell me, the listeners, a little bit more about exactly how that process works?
Yeah, I realized that we actually haven't talked much about the product and how it really works. So we've built technology that is here to take your history as a patient. That means that looks into your symptoms. And we want to keep this very human and very friendly. So when you start up the app, GYANT will always say something like, how can I help you today? And then you'll just write what you have. We're using natural language processing to understand these medical concepts in your complaint, and then start to ask you questions. And that's all through our artificial intelligence. It's again, surprisingly delightful experience because we've put a lot of work into making the personality of GYANT friendly and sometimes even funny, a little bit witty, and just like, you would expect your friend to talk to you. And so we're typically asking 20 to 25 different questions to collect symptoms. And then that's what I call the magic moment. Now that we've collected all of this information about you, and actually, so some people do access GYANT through their health systems, their hospital's app. In that case, we do even have access to the health record, so it's even a richer profile. So it's 20 or 25 questions plus everything that has been in your health record before. And we pull that in, all of this information, everything that's relevant, and we put it into a nice little form. And then we have doctors on our side that look at all of the symptoms that we've collected from you. We give them information about what could be correlated conditions there. We tell them for these correlated conditions which treatment plan would be adequate. And in the best case, and that happens actually in 81% of the cases, doctors look at the information that GYANT has collected and say, in 81% of the cases, they say, yes, that's all I need. Here's my diagnosis. This is the treatment plan. And they're out again. So that is the magic moment, because that's how within 7 minutes you go from starting to chat to having the prescription in your pharmacy. And what we do after that is we go beyond the cure to follow up with people and make sure they're feeling better. And so once you've gotten your treatment plan or your prescription, then GYANT's AI will check back in with you to make sure your condition improves along the timeline that it's supposed to. And also, GYANT remembers each patient. So we build a profile about you and we continue to learn after every interaction. So a little bit, like your friend who happens to be a doctor, the more you know him, the more he knows you, the better he'll be able to diagnose you. And in this process, we show empathy and build real relationships with patients. So, there's a couple of things that your mother will say when you're sick, and there are some things that your doctor will say when you're sick, and we want GYANT to cover both.
I love that. And I also love how GYANT learns from every single patient visit. But can you tell me a little bit more about the technology behind it and how it learns from each visit?
We learn on very many different dimensions. So, for example, GYANT has been used over 3 million times, right? Over 2.5 million people have used it. Over, I think, 3.5 million times they've expressed their complaints to us. And we've built quite some powerful natural language processing to understand what people actually have. And that's a completely new data set, because no doctor, nowhere in the world, writes down word by word what the patient tells them in their doctor visit. This is something that only we have. Over 3.5 million symptomatic complaints from patients. And we're now very good at understanding the symptoms that are in there. And that's one thing that we do. And as I say, we had so many people who have been using GYANT. And every time that somebody uses GYANT, we learn about symptom and condition prevalence. So we see how often people actually do develop a fever and how that trends through different demographics, how that trends differently, probably through different demographics in a different geography. So symptom and condition prevalence, something that we just extract from the 25,000 users that we have every day. And then also through one of our investors, we've gotten access to millions of health records, which help us, and they're health records from the emergency room, from primary care clinics, and they teach us a lot about the correlation between symptoms and conditions. And as I said, 81% of the cases our doctors can diagnose from the history that we have collected. And in general, the more the patients share their symptoms, the more of the symptoms that they share with GYANT, the more nuanced and the more accurate GYANT will get. And I think it's for that, one strong point of GYANT and one strong way for us to collect all of this data and to get access to it is that we do have a lot of usage. And the other one is that our customers that we integrate with, health systems and hospitals, they often give us access to their health records. And so we see that if we have a patient that comes to GYANT, that interacts with us, and that probably later on that we say, you know what, with what you have, we can't really help you. You have to go to see a doctor, and please go to this address. There's exactly the right doctor for you here. We'll see what's happening in their health record afterwards, so we can close that learning loop and improve our engine based on the health records that we see from patients in real life.
So I've got to ask, how did you get here? Can you tell me a little bit more about your background and the inspiration behind GYANT as well?
Yes, absolutely. I'm happy to do that. So I've had this idea for a long time, actually. When I was 25, I was working in Central America, and it was an amazing time for me. But at the same time, it left a deep impression on me how often people would be suffering from from common conditions, and they would be suffering much more than you would expect them to in Britain or in California. And that lack of access to doctors and to resources, that just stuck with me at that time. And then fast forward 10 years, I had joined and built a leading gaming company in Europe with 400 people, and we were building all of these beautiful games. And I learned more and more about the importance of design and technology to engage customers and to come back to you every day and to actually talk to basically artificial intelligence in these games. And I thought that all of this technology of hooking people into a product and that must be possible to apply that to significant pain points in the healthcare system, and to and at the same time to make healthcare much more gratifying for patients and doctors. I always say we want to build products that don't smell like a hospital. But then there was this one day, and I think it was December 26, 2008. It was half a year after my son was born. And I was sitting there at my parents-in-law's house, and I looked at my 10-month-old boy, and I looked at him and I saw that he had this bony growth on his chin. And I looked at him, and that was really scary for me, and I freaked out, and my wife as well. And after Christmas, everything shuts down in Germany, and we didn't get in front of a doctor for the next 6 days. And we were out of our mind scared. It turns out it was nothing. Yeah. But obviously, we did Google our symptoms, and you see very, very scary things there. And at that moment, I realized that I have to do something. And I started a company that turned out to be one of the largest doctor appointment booking companies in Germany that then got acquired by the Yellow Pages. And that was my first step into the world of healthcare, where I wanted to get patients to their doctor much quicker. And GYANT is the continuation of that story. Now that we have access to data, now that we have access to artificial intelligence, to neural networks, machine learning, now we can go deeper than just getting people in front of the doctor and transform the nature of the doctor appointment by helping doctors do more through technology. And that's where we are.
And here in 2018, of course, you're already treating patients in California, but what does your roadmap look like, and what can we expect in the next 12 to 18 months?
Sure. So we're busy closing and integrating 10 health systems at the moment and payers. And that's all going to happen through the next 6 months. So just through these systems and payers, there's going to be more and more people that will have access to GYANT and to GYANT's services and to all the good that we want to bring to the world. Another important initiative is that we're adding pediatrics. So right now we focused on, at the beginning we focused on adults, and now we're adding kids. And that's obviously an important area because kids are sick often, and parents tend to be concerned. Actually, if you look at the emergency room topic that I had before, 82% of all emergency room visits of babies under 12-month-old are avoidable through telemedicine. 82%. That's a lot. That's a high number. A lot of parents that suffer through nights sitting in an emergency room while they wouldn't have to. We also will have more to offer for chronic conditions around diabetes and hypertension. Those are the two areas that we're focusing on more and more. We've just had a project where we screened over 700,000 people in Mexico for pre-diabetes. That was very successful. Very interesting to see what our platform can do, and to help raise awareness and diagnose completely underdiagnosed population health level diseases. So we're working more on chronic conditions. And then obviously we'll be available in more and more states and countries.
Well, before I do let you go and begin your Thanksgiving celebrations, could I just ask that you remind the listeners of where they can find GYANT online, and also maybe reach out and contact a member of your team if they've got any questions?
Yeah, absolutely. So you can find us, best way to find us is on the App Store. Just look for GYANT, that's us. And if you want to get in touch with me personally, that would be great. I would be happy to talk. I love this topic, and I love to talk to people who are interested in it. My name is actually pretty unique. Last name is Zuta, Z-U-T-A, and you can find me on LinkedIn by either typing in GYANT or typing in Pascal Zuta, and that's the easiest way. I react to that pretty quickly, typically.
Well, I'll add those links to the show notes just so people can find you nice and easily. But I love what you're doing here by using technology to create a proactive healthcare system, and also how you're not replacing doctors but actually combining the best of AI and giving them a tool that can help them increase efficiencies in healthcare. It's a fantastic thing. So thanks for coming on and sharing that with me today, Pascal.
Thank you so much.
I love how GYANT's AI pulls together a diagnosis which is then confirmed by a medical practitioner who can easily prescribe medication if it's needed. Plus, how GYANT actually remembers each patient and continues to learn after every single interaction, and is built for that long-term care, but at scale. A proactive approach to healthcare rather than reactive has to be a great thing. But equally, I love how tech is being used as a tool for doctors, not to replace them. And we've all heard of inefficiencies and long waits for treatments. So if tech can ease the pressure on healthcare, again, for me, it's got to be a great thing. But over to you. I'm not a healthcare expert, maybe you are. So email me, techblogwriter@outlook.com, tweet me @NeilCHughes, or pop by my website, techblogwriter.co.uk/podcast. You can listen to today's episode and all 700 of the other interviews that we've had on this show. If you have been out there in the Black Friday sales, if there's something you want to buy, if there is a big bargain that you're after, I want to find out the best bargains that you've snapped. So send me a quick tweet as well, or a quick email, and let me know what you've managed to secure, if there is any big tech deals out there that I should know about. But I'm afraid that's it from me. So a big thank you for listening, and until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.